So yeah, as your loved one gets older, there's going to be a little bit more challenge of them being able to control their bowel and bladder, and that may be more and more of an issue. So when they first get in the home, when you go visit, you got to emphasize the staff about, you know, remind them about, toileting your loved one. And they're supposed to toilet them when they get up, after every meal, and then before bed, and whenever they ask to be toileted, basically. They don't always do this religiously, for sure. They don't do it. So I would, whenever you go to visit, just say, hey, when did mom get toileted last? Or when did, whoever get toileted last? And just kind of keep those reminders coming whenever you go. So you realize, and they realize, hey, this is something critical, important to them. They're going to be asking me, having a loved one there, visiting occasionally, just asking questions, they'll get better care. Hate to say that, but that's kind of what I think is the dynamic a little bit, because they know there'll be somebody asking them about it. So, and checking on those things. And, they should have, if they're really incontinent, they should have a brief put on them, right? And the regulations say that you're supposed to be checking for incontinence every 2 hours. Don't always do that either, right? So, you might want to try doing something like the inspectors do. As a little tip. If you find that they are incontinent, their brief is incontinent, you can go in there, just make a little pen mark somewhere where it's a little discreet, but you know about it. And, go back later in the afternoon or whatever. If that brief is still on after 4 hours, well, bring it to the attention of the charge nurse. Tell them, hey, what is going on here? I'm concerned. And then I'm going to take a little breath. I'm getting out of breath. I don't want to be huffing on this video. And then bring it up to the charge nurse. Let her know. You don't have to be nasty about it. Just let her know. And then, a week or two later, do the same thing. Check again. If there's a problem, I would go to the DON and say, hey, I've checked this time. I've checked it twice. And hopefully they'll get more attentive to it. I'm not sure if they'll stick to it over time, but if they know that you're kind of checking every now and then, they'll be more on their toes, to making sure it gets done. So that's one suggestion I have. The other suggestion, if they really have a problem, do I want to say it here or do I want to say it with the pressure sore? I'm going to say it here because I got so much to talk about in the pressure sore area that, if your loved one has, really very little bladder control, and they are the type that are more frail, and they have a hard time repositioning themselves, you might want to consider asking that they be laid down between meals. Because at least on that chance, staff should be, if they lay them down between meals, they should be taking off that brief, which means A, the brief goes off, and B, they get some fresh air to their skin, or and then they're laid, usually when they're in bed, they're laid on a incontinence pad. So any kind of waste, if they have any accident while they're in bed, it goes on the pad. It doesn't go trapped on their body. Now, there's different perspectives. Some facilities think that, well, it's better to have that brief on where they're lying down so it'll pull the moisture away. But I'm more of the opinion, no, because I don't want staff leaving that brief on them when they lay them down, and then they leave the dirty brief on them when they get them up. I want at least that dirty brief taken off so a new fresh brief is put on. And that's going to happen, if you insist on that they not have a brief on where they lie down, right? So that's one thing I would do if they were really incontinent. But also, if you do something like that and they're lying down in between meals for any period of time, you want to check the night shift staff after about a week or two of doing this. Say, hey, they having any problems with their sleeping? The charge nurses, are they irregular? Are they getting up at night? Anything like that? Because, you don't want to disturb their sleep patterns either. So that's definitely what I would do if I had a loved one who had issues with incontinence, to keep their skin protected and then keep them getting changed. Next time I talk about pressure sores, a big important subject. There's a lot to it. Hope you can see that one. If you like this video, found it helpful, please give me a thumbs up, share it with anybody that might be a benefit from it, and go ahead and check me out a little further about my information that I can share with you through www.nursinghomerisk.com. That's nursinghomerisk.com. See you in the next one.